Yeah, so I'm back to discuss and demonstrate seeking consent for intra-oral massage. The technique of intra-oral massage is really, it's a bit tricky because you're in the dark, you can't see where you're going, and you have to know your anatomy pretty well. But the techniques tend to be not that tricky. The tricky part is really you're going to be sticking your fingers in someone's mouth, and that's supposed to be relaxing somehow. And a lot of people have been, well, the reason you're there is because they find it hard to relax, one. And a lot of people have had bad histories with the mouth. The first time I went to the dentist, he was probing my teeth to see if they were competent, and I was terrified. And he said to the nurse next to him, he said, "Oh, well, Dr. Brown last week was doing this," and he slipped and he ripped right through this little girl's lip.
Ooh.
And she was crying all the time up until the ambulance came. So I was terrified, and I carried that terror with me like for a long time, decades. So that really affected me deeply in terms of what I did to take care of my teeth and the whole oral health thing and so on. So dentists are much better trained and tend to not try to traumatize people. But all sorts of things can happen inside people's mouths. So I recommend treating everybody with the equivalent of universal precautions, in the sense that, if you see someone's blood or something, you need to have a barrier with that, because you don't need to know what kind of microorganisms are in someone's blood. Just treat everybody's body fluids like they may have something in that is dangerous. So I treat every client intraorally as if someone has not treated them well. And for people who have not been treated well, then the biggest thing that they can often get is a sense of safety and that they're in control of the treatment. So when I seek consent to treat somebody intraorally, then I need to give them a sense of why I want to go there and everywhere and everything. But I need to give them a sense of empowerment. So I'm just going to demonstrate that. Hey, sorry, Molly. I'm shaking everything here. And I'm just simulating as if we had a whole historical reason to be doing this, because Molly's jaw is pretty fabulous. But as we were talking earlier, Molly, you've got all this clenching and grinding in your jaw. Some of it related to when your mother-in-law is in town.
Yes.
Some of it not. And the joint itself has been sore lately, and it's just really hard to relax in there.
Yes.
So I'd like to help out. We've tried some massage externally here, and it's helped a little bit. But it comes back within minutes, and my experience has shown that intra-oral massage is more effective. So do you have any questions or concerns about that?
I don't think so.
Okay, let me tell you. Yeah, let me tell you some more. Okay, so I put a glove on. So my skin has got this glove on it, and it's not a latex glove. So have you had any problems with gloves in dental offices? So you don't have any allergies that you're aware of?
No. Not
Okay,
that
these
I'm
are the
aware
great. So the common allergy people have is latex. This is not a latex glove, so that's good. And the idea is I just put my finger in your mouth, and really it's just in your cheek. So it's not between your teeth, so it doesn't go anywhere near your tongue, which is like a really gaggy zone and everything. And so it's not gaggy. If you've had enough at any point, all you need to do is just raise your hand like that, because you might not be able to speak easily, or you don't want to.
Sure.
So I also say, that's the common thing, is raise your hand. I often encourage people to shake their head too.
Okay.
My finger's here, I got it. So I could be, drifting or looking out the window, but I'm going to sense that. Okay? So,
Sounds good.
Sounds good to you, great. So I'm going to put a glove on, and we'll just get started with that.
Okay.
Great. And what I'm going to demonstrate is that when I get started, after no more than 20 seconds, I'm going to take the glove out. I'm going to take my finger out, say, "Hey, how are you doing?" So then, I've said that I want her to be in charge and in control, but I demonstrate with that. Just like our children, we can tell them to do something, but it's really our behavior that they track,
Sure.
and rightfully so. So clients are the same.